Greetings of the day. In this video, we are going to discuss how to screen and assess the patient with intimate partner violence history. So, many experts, including U.S. Preventive Service Task Force and American College of Emergency Physicians, recommend routine screening for intimate partner violence. So, a protocol should be implemented to address and identify and screen for intimate partner violence. So, training of the ED personnel is very important, and confidential interviewing is very important. And appropriate intervention, including validation and referral, is also a part of the program training. So, multicultural multilingual information about the intimate partner violence and effects on the abused individuals and family members should be made available to the public and employees. This may consist of posters or brochures in the areas the hospitals, such as public areas, examination rooms, and restrooms. Community resource that provides service to the victims should be a part of the shared information. Screening should be conducted by the providers educated about the dynamics of the intimate partner violence, and we must provide a safe and private environment for the interview. Take into account cultural differences and expectations. If language interpreters are required to use individuals who have no connection to the patient. Document screening results, safety assessment, and any interventions, including referrals and required recording. So we are going to discuss a table which shows the screening assessment and shortly. When conducting screening and assessment, be non-judgmental and sensitive and direct. Let patient know that you take this situation seriously. Okay, assure victims of confidentiality. Communicate an understanding of the complexity of the situation and difficulties of achieving a quick fix. Reassure the victim that no one deserves abuse and victims are not at fault. If it is the abuser whose behavior is unacceptable, avoid pressuring, respect the patient decisions, and work together to determine an appropriate course of action. Ask abused individuals if they have a suicidal or homicidal ideation. Such ideation, particularly if accompanied by a concrete plan of action, should trigger immediate consultation with a mental health provider. So we are going to discuss a sample of an intimate partner violence screening questions. The healthcare worker should explain the following in his or her own words. We are concerned about your health and safety. So we ask all the patients the same questions about violence at home and personal life. Violence are very common, and we want to improve our response to the individuals and families experiencing violence. The healthcare worker may ask the following questions of all patients. Are you aware? Are you ever afraid of your partner? In the last year, has your partner hit, kicked, punched, or otherwise hurt you? In the last year, has your partner put you down, humiliated you, or tried to control what you can do? In the last year, has your partner threatened to hurt you? If the intimate partner violence has been identified in any of the above questions, ask if the individual would like assistance today. Be prepared to offer resources, assess for safety, and discuss a safety plan with the individual. Okay. So the summary of the National Consensus Guidelines for Screening for Intimate Partner Violence and Abuse in the ED is in this table. So we are going to look at the screening and assessing, intervention, documentation, and after that a referral. This concludes this video entirely in this table. So screening, routinely screen at every visit. Screen for current, and if time allows, screen for history of abuse. Screen privately or with a non-related trained interpreter. Ask what happened, when did it happen, where did it happen, who did this. Respect patient decision to disclose or not. Discuss any required reporting. Include screening questions on intake forms. Okay, so we must do the screening in these aspects. So assess the immediate safety, assess health impact of the abuse, assess pattern of abuse, and assess for danger and potential lethality. And if the danger assessment findings positive, assess potential for suicide or homicide. What intervention is required in these circumstances. We must listen carefully and provide support. We must we must communicate this in these terms and in these words. I'm concerned for your health and safety. You are not alone. Help is available. It is not your fault at all. You don't deserve it. What happened to you can affect your health. Provide information and materials. And we must ask, what can I do for you? And we must provide a safety plan, offer services including an advocate, social worker, police, and shelter. And all these should be documented in a legible, fluent, and maintain confidentiality of the records. We must also mention the abuse history, like subjective information in patient's own words, and also objective information, detailed description of the patient's appearance, behavioral indicators, injuries, and health complaints. And also, we can use forensic evidence kits where appropriate, and also mention the results of physical examination, use of body maps, photographs, radiologic laboratory findings, collection of forensic evidence, clothes, debris, etc. Any material and referrals offered, results of health and safety assessment. And after finishing the documentation, we can refer to the primary care physician if the negative, or a mental health provider if the patient has mental trauma, or social worker or intimate partner abuse advocate, and obtain permission to notify the provider. So no current phone numbers about these things in your respective countries, like abuse and assault prevention programs, legal services, children's program, mental health services, law enforcement, substance abuse programs, transportation, local clergy, or other community organizations. So we must do all this. This concludes.